Do no harm, an oath shattered by the opioid epidemic. In this episode, we explore the ignorance and greed that led to our current crisis.
One of the first rules in medicine is do no harm. It said that Hippocrates was the first to say this. And what that means is that the cure for any medical problem shouldn't be worse than the disease that you're trying to treat.
A big chunk of America is in chronic pain, and it's pain that's back pain, knee pain, arthritis, and it's real and it affects people's lives, and they would like a way to live their lives, to take care of their families without being in this pain.
The brain in pain is a different brain than the normal brain that's not in pain.
People have it in their head that there's a pill for something, regardless of whatever my pain is. There's something out there that's going to help me. Then there was this new miracle drug that's going to eliminate all your pain.
Inside the company, when the drug came out, they received so many letters from people who had been suffering for years with no relief, who finally felt like through OxyContin, they were getting to be alive again in a way they hadn't for years, and that they considered a miracle drug.
It's the best thing that happened to me. If I wasn't on this medication, I just wouldn't be able to do the things that I'm doing now.
There's no question that our best, strongest pain medicines are the opioids. They do not have serious medical side effects.
Patients are just ATM machines. The more you go back to that patient and the more you push buttons, the more profit you can be made.
The pharmaceutical companies also were not entirely transparent about the addictive effects of opioids. And doctors were told they were non-addictive when in fact they were addictive.
We don't get taught in medical schools about illnesses that we induce. We only get taught about illnesses that we're supposed to cure.
We also grew up thinking that doctors were always right. So if you have a prescription, it's fine.
When we talk about opioid painkillers, we are essentially talking about heroin pills.
The drug companies are the cartel, the doctors are the pushers, and the pharmacists are the suppliers. That's how the DEA is seen.
There's not a city in the United States right now that doesn't have a major opiate addiction problem. And it's not just in cities, it's in rural areas. In fact, in some places, it's worse in rural areas than anywhere else.
At the peak of the epidemic, millions of people in the United States were prescribed 259 million prescriptions of opioids.
It means on average every adult is on one opiate, once or twice a year, if not more. Scares the living crud out of me.
The pharma companies, if they're making products that are making lots of money, and they can start saying to themselves, yeah, but we're really meeting a need. We're really meeting a need. Well, we're also making a lot of money.
Opioids are a major category of medical spending. According to the Centers for Disease Control, it's about $24 billion in direct costs for the medications, another $75 billion in healthcare costs.
People are doing an OxyContin 80 10-pack a day. That's $1,000 worth of medication a day. Kids were spending hundreds of dollars a day, if not thousands. And heroin walked into town. And it's cheap, really inexpensive, readily available.
The shame of addiction keeps us from knowing the actual numbers. But at least 2 million Americans, and probably millions more, are addicted to prescription opioids.
Prescription drugs are now causing more deaths, for example, than car accidents.
From 1999 to 2017, over 500,000 Americans have died from an opioid overdose. More than all the Americans killed on the battlefield since World War II.
We have skyrocketing rates of infants born opioid dependent.
Parents who have lost children, you have families decimated, you have towns destroyed. And to think that it started off with, a company in Stamford, Connecticut that had some marketing material.
This is the worst man-made epidemic in the history of American medicine.
It's very clear when one looks at the overprescribing of opioids that's led to this public health crisis that the medical community really forgot the first rule, which is do no harm.